Hi, I'm Jamie, a pediatric oncologist, and I'm here to help you understand leukemia. Leukemia is cancer of the blood and bone marrow. It begins in the blood-forming cells known as stem cells, which are found in the bone marrow. The bone marrow is a soft inner portion of bones where blood cells are formed. When someone has leukemia, the body produces abnormal blood cells. They grow and reproduce rapidly in the bone marrow, taking up space from healthy cells, and can eventually spread to other parts of the body. The most common type is acute lymphoblastic leukemia, also known as ALL. Common symptoms of leukemia include feeling tired and weak, fever, easy bruising or bleeding, shortness of breath, loss of appetite, and swollen lymph nodes. Doctors diagnose leukemia with blood and bone marrow tests. First, someone in the doctor's office takes a blood sample from the patient. Laboratory tests are used to examine the cells and certain substances in the blood. Abnormal numbers or changes in the cells may cause doctors to suspect leukemia. In most cases, a bone marrow aspiration and biopsy are required to diagnose leukemia. For this procedure, a small piece of bone and a sample of bone marrow are removed by a needle and examined for leukemia cells by specially trained doctors. Additionally, a lumbar puncture, also known as a spinal tap, collects fluid from the spinal column to see if leukemia has spread to the brain and spinal cord. The main treatment for leukemia is chemotherapy, which is special medicine to treat cancer. In some cases, doctors may recommend a stem cell transplant. This treatment gets rid of abnormal blood stem cells in the bone marrow and replaces them with healthy cells. Another treatment option may be targeted therapy, which uses drugs to attack cancer cells without harming healthy ones. Participation in a clinical trial may also be an option to consider. Clinical trials are carefully designed research studies that test ways to improve cancer treatment and care. A diagnosis of leukemia can be overwhelming, and it is important to remember that you are not alone. Now that you have the basics of leukemia, look around the site for more in-depth information and answers to cancer questions. And please remember, we are here to help you face childhood cancer together.